Usmle Step 1 Pharmacology. Chapter 1 Pharmacokinetic. Pharmacokinetic characteristics of drug molecules concern the processes of absorption, distribution, metabolism, and excretion. The biodisposition of a drug involves its permeation across cellular membrane barriers.
This is figure of drug biodisposition when drug is administered, intramuscular, PO, etc. Absorption occurs into plasma. Plasma distribution occurs to tissues bound drug and then converts to free drug. Drug goes to sites of action receptors. Tissue storage. Drug metabolism occurs in liver, lung, blood, etc. Drug excretion occurs in renal, biliary, exhalation, etc. Permeation. Drug permeation is dependent on the following. Solubility. The ability to diffuse through lipid bilayers. Lipid solubility is important for most drugs, however, water solubility can influence permeation through aqueous phases. Concentration gradient. Diffusion down a concentration gradient. Only free, unionized drug forms contribute to the concentration gradient. Surface area and vascularity, important with regard to absorption of drugs into the systemic circulation. The larger the surface area and the greater the vascularity, the better is the absorption of the drug. Ionization. Many drugs are weak acids or weak bases, and can exist in either non-ionized or ionized forms in an equilibrium, depending on the pH of the environment and the pK, the pH at which the molecule is 50% ionized and 50% non-ionized. Only the non-ionized, uncharged, form of a drug crosses biomembranes. The ionized form is better renally excreted because it is water-soluble. Weak acid RCOOH crosses membranes, converts into RCOO plus H positive. Better cleared. Weak base RNH3 positive. Better cleared, converts into RNH2 plus H positive. Crosses membranes. Figure shows degree of ionization and clearance versus pH deviation from pKa. Note. For weak acid and weak bases, ionized is equal to water soluble. Non-ionized is equal to lipid soluble.